Carrie. Welcome to this week's Pet Ranch Roundup. Thank you so much for coming to hang out with us. This is my dog Bolt. You probably know him. If not, you should know him because he's pretty awesome. He's looking older, right guys? Look at this. Look at this little gray face. He's starting to get a little sugar face here. But you should go back and check out all the Roundup videos. I'm gonna put a couple playlists up that are in order. That way you can kind of get caught up with our patients and just everything else that was going on in our lives at that time. Anyway, we are gonna kick off this week. I don't know what this week holds. Just like any week, it just is a toss-up. You start out trying to take care of the animals you have, and then just a whole tornado of things can get dropped in your lap. So we'll just jump right in and go see what's going on. I know for sure we can go check on Lunchables kittens. I mean, that makes me feel good every morning when I do that. So let's go do that. Oh, does that feel good? Does it feel good? He says, please don't stop. Hey, Mama. Did you move to the penthouse? Oh my gosh, these kittens are so pink. Look at those toe beans. Hello. Did you see these toe beans?
The kittens?
Oh my goodness. It hurts.
Yeah, they're cute.
Look at this. Look at this. Look at this.
They're little chunks.
She's a good mama. We are here with an impromptu, I guess that's the way most of these emergency cases are, case. But I got a text message with a picture from a volunteer that they were at the shelter at the same time. Somebody was surrendering 4 Border Collie or Border Collie mixed puppies for possibly having parvo. Really don't have any other backstory than that. I wonder if there was like 8 puppies and 4 had died. These are the healthier ones. This one's a lot healthier. Is this the one that ate?
No, he's actually didn't eat, but
You didn't eat?
He's too busy yelling it out.
Okay.
And she ate a little bit.
Okay. She ate a little bit.
And she ate all her food.
All her food.
This one doesn't feel that great.
Yeah, that's gonna be the next one. But there's those 3, and then there's this kiddo that looks terrible. So before I got here, they put an IV catheter in, and we got the blood glucose.
No, that's the boy.
That's the one felt good. That blood glucose, and I was hoping that was going to be really low because that's something that we can easily correct. Also, they have hookworms. I was hoping, it's okay, baby, that he was going to be really anemic, but pretty pink. And temperature's 105.6. Normally, a dog is around 101 to 103. So that's pretty high. Also, you can see his eyes are very sunken in, which we see with severe dehydration. So we're just gonna give him a shot. We have a chance, but I really don't feel good about this guy. But he was gonna have 0 chance at the shelter, so there's that. But anyway, catheter in, we'll be plugging away overnight. We're just giving our first dose of Panicure, which is a dewormer. They didn't like it. Forgot to record the other ones, but it's alright. This is the girl. What are the sexes of the other ones?
They're all girls except for the naughty little boy.
Oh, that's a good. They hate that. I'm so sorry. That's the worst. We're going to get rid of those worms in your belly, though. Yes. I know. Trying to kill me.
Yeah, all of them are like 9 pounds and that one's only 7.
Okay. We got a little bit of a 10-pound dose. So.
You are naughty.
Forgot to show their parvo test is very positive, or that sick one is anyway. This is the control at the top, and then the positive test on the right indicates that they're parvo positive.
This is the sample from the Border Collie puppies, and we see some hookworms. Glad to see no coccidia, no roundworms, but there are hookworms, and we do expect that in young pups of this age. Unfortunately, we just see it so often, and there's quite a load here. A lot of worms or eggs per high power field, so we're going to act aggressively and deworm them.
Day 2 checkup. You're still a wild child. Ate a lot of your food, not all of it. You are so much brighter. You ate all your food. Good girl. I'm glad to see you feeling a little better. You're brighter today. Ate all your food. Baby. Hi. Goodness. It's time to little kiddo is still hanging in there, so that's good. Not interested in food, a little bit more alert today. Baby. You gonna stand up all of a sudden? Oh, never mind. I changed my mind. Okay, I'm sorry.
Well, hello.
Third day we've had these kiddos. I guess it's technically about 48 hours, right? Because they came in the afternoon. Tuesday afternoon. 48 hours. I am amazed and surprised that this little kiddo is hanging in there. It's because she's a border collie. The coolest in the world. These little turkeys are great. You were so quiet yesterday. You are a troublemaker, but so cute. He's a cute troublemaker. He's a cute troublemaker. He's a cute troublemaker.
Can't stand
Oh, he's so cute.
it. Take these two pet and she can walk. But don't let Ryder's pet out either food.
That's on camera. That's on camera. She said Ryder's bat. Beep. Melody's gonna see that. Beep.
Okay, here we are with B2. We're a few days into the parvo hospitalization treatment. Dr. Carey has been tube feeding this guy to try to keep the gut going, and we're going to continue that this morning. Here we go. Good. Oh, 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 oh. That went well. One thing that we're looking for, or I always look for when we're doing that, is definitely no coughing when we get that tube inserted. We know it's going down the esophagus and not into the trachea. And then when we pull it back, we didn't get any fluid back. That's just Dr. Joe's little tidbit. I just got to educate a little bit.
Good job.
You know? Well, we're going to keep rolling with this puppy. I think Dr. Carey, it's her day off actually, but she's going to come in and take a look, and we'll just go from there.
Wake you up? I'm sorry. Boy. Girl. Hey, good girl. Hi. Girl. That's so cute. This little guy just came to us from the Green Bush. Cut.
Action.
All right, Avery made us cut. She said he's gonna poop, but that's just the way his booty is, okay? People can just take a chill pill. But anyway, this is our little Augustus, also known as Augie. He smells real stinky right now. He has demodectic mange, and everything looks pretty good from this side. And he's stretching. Why are you doing that face? But he also has kind of some joint deformities, and it's probably gonna get a little bit worse as he grows, but hopefully will resolve with time. And his tail's all scaly. So we're gonna treat him for his demodex, start some medicated baths, give him an injection of an antibiotic, and just go from there. Well, he's a little,
Hey, big baby.
ew, you have poop worms on your poop, big guy. Oh, please don't step in it. This is our life, everybody. Poop foot. Oh, now look at him. He's got a poop shoe.
We were going to take a parasite sample, but he had a BM. For anyone under the age of 70, that is a bowel movement, so we do not need to do a rectal sample, which is awesome. But we're going to get him vaccinated, hey buddy, with his first distemper parvo vaccine, and do a little skin scrape here to check out what is going on with his skin. When we do this, I always like to actually get all the way down to the blood barrier there. So I always like to collect a little bit of red blood cells because some of those mites can live in those places. And since he's a resident here right now, we're just going to take this one sample. and take a good look. If we get a negative sample and his skin doesn't improve, we'll do serial or multiple samples. Excellent. Well, we found some roundworms on our new shelter puppy that we pulled, so we will deworm this guy appropriately. It's funny, usually we see a lot of hookworms and roundworms, mostly hookworms, but this guy only has some roundworms. That being said, we use a broad spectrum dewormer in situations like this, so all will be well.
Poor Augie. These kitties are just torturing him. Look how that cat is right now. Have you seen it? I guess we know he's okay with cats, or we would have had a little kitty thigh for lunch. I bought Crimson this bed today, and he sat on the top, and he refused to get in until he couldn't take it any longer. I knew you'd love it. Oh, he just gave me like a rude little nod. So cute. Why are they jerks? They just... Shh, we're filming. Don't be rude. Okay. Oh! Reverse sneeze attack. Oh. Did you get a new harness? Do you love it, Tink? Do you love it? Do you love your new harness? That's a no. She doesn't love it.
What happened?
Did you know you're getting your surgery today?
She has no idea.
Tink.
Tinkers, I won't do it.
Nah.
I can't do it.
She'll be so
gotta
sad.
leave.
That's Tinker's favorite person. Stinka-tink, are you having surgery today? Stinka-tink. Look at all the toys she has. Dog doesn't go in a kennel. She's got 17 toys. Oh, so cute.
Look at the baby.
Are going to Petco today. I think their brothers Verb and Noun are gonna miss them, but I bet they'll get adopted quickly. So like Dee Dee has not really grown at all. She's still tiny. Like she never had a fracture though. And of course this guy, Precious. Dex, Kiki Kitty. What? Who's meowing? Who's meowing? Oh, it's Lunchable. And they're growing back white. What is that called when that happens?
I don't know.
There is a technical term for that. If it's a black kitty or black dog and then they get a scar, it grows back white. And this is almost what they use for freeze branding and like some horses and cows. Let's look at his little tail.
It's so cute.
He's so cute.
the cutest tail. It's such a cute little leg.
And then when he gets worked up.
He likes to play with Bird's tail because he's missing his.
Aww. Vaccines coming in.
We are here with Dee Dee and Dexter, and they are headed. In fact, our transport, our lovely transport, which we need more of, is off camera. So we're super excited, watching live, behind the scenes. But we're super excited for these guys. They've been here a bit. This is their last round of vaccines, and then we're going to transport them to Petco. So hopefully they can be on the showroom floor and get adopted and get some exposure there. So ultimately, I always just have to mention, especially when transport's here, that this is our goal. Our goal is to find that forever final home. So I'm super excited about it. So today they're going to get their FERCP and their feline leukemia vaccine and some prevention of revolt, which is heartworm and flea prevention. So here we go. Who wants to go first?
Dex.
Dexter.
Bye, Dee Dee Dexter.
Bye-bye. Special shout out to all the transports in the world because we need more of those. Thank you.
See me in here. Chai's taking the no kitty pledge today. She's fine with that.
I promise
I promise
to not have kittens.
to not have kittens.
Never again.
Never again.
Even though I'm a good mom.
I'm a cute mom and my line lives on, but no mas. No mas.
I think she's gonna do that.
She's a little pistol. I think we need to address your arms. No, because I thought that Lunchable was painful, and then April and I realized she's just high as a kite from her really good pain meds. Chai. You good? Oh, those pupils are. Whoa. You good? Are you, you good? Oh my goodness, she's so crazy looking. Gonna spay Babel today and get some x-rays while she's sedated because it's gonna be hard to kind of move her legs around. She has a foster to adopt, hopefully. That's gonna take her to a lot of physical therapy. So this is the first step, girlfriend. I know, don't you do it. You're not supposed to do that. Oh. I don't want to get a spade. Guys, April's gonna be on edge today because her dog is getting spayed, so which means all of our day is screwed. Right, Ryan?
Right.
Well, it's a pretty good week. I mean, I'm still really on the fence if our little parvo dog is gonna live. I really hope so. It's gonna be a lot of intensive care over the weekend, but I'm glad that we had the opportunity to try and save them. That's what matters ultimately, is that we tried and we didn't give up like the person that just dumped them at the shelter. Speaking of that, just spay and neuter your dogs. Okay, sorry, it's been a long week. So if you donate to Abandoned Pets Project, I am in your debt because I could not do this without you. We could not do this without you. We all thank you so much. Consider subscribing to our channel if you like our content, if you like animals and love seeing them saved, because we love saving them. And consider turning on your notifications and sharing our videos. We need more views so we can, you know, save more lives. But anyway, thank you guys so much, and I will see you next week. Bye.
Your little tail just a wagging. You are a sweetheart. Yes, you are. Yes, you are.